Have you ever wondered why some people look not too overweight, but still struggle with serious health issues? That hidden culprit is visceral fat, the type of fat that wraps around your internal organs like the liver, pancreas, and intestines. Unlike subcutaneous fat that sits under your skin and is visible, visceral fat stays out of sight, but quietly disrupts your metabolism in powerful ways. If you care about your long-term health, take a moment to like this video so more people can learn how to protect their bodies early. Visceral fat is not just stored energy. It behaves like an active organ. It releases inflammatory substances and hormones that interfere with insulin function. According to research published in major medical journals, high visceral fat is strongly linked to insulin resistance, which is a key driver of type 2 diabetes. It also increases the risk of heart disease by raising LDL cholesterol and lowering HDL cholesterol. Even more concerning, studies have shown that people with higher visceral fat have a significantly increased risk of early mortality, even if their overall body weight seems normal. Here is the surprising insight. You do not need to look obese to have dangerous levels of visceral fat. This is why focusing only on body weight can be misleading. The real goal is not just to lose weight, but to improve metabolic health from the inside out. Understanding this difference is the first gentle but powerful step toward taking control of your health in a smarter and safer way. Many people believe that as long as their weight is normal, they are safe. But visceral fat does not always show up clearly on the outside, and that is what makes it quietly dangerous. In fact, research has shown that even individuals with a normal BMI can still have high levels of visceral fat, a condition sometimes called normal weight obesity. One of the most common signs is a growing waistline, especially when fat accumulates around the abdomen rather than the hips or thighs. According to the World Health Organization, a waist circumference above 90 centimeters for men and 80 centimeters for women in Asian populations is associated with increased metabolic risk. But beyond appearance, there are subtler signals your body may be sending. You might feel constantly tired, even after sleeping enough, or notice frequent sugar cravings and energy crashes during the day. These can be linked to insulin resistance, which is closely tied to visceral fat. Blood test results can also reveal early warning signs, such as elevated fasting glucose, high triglycerides, or low HDL cholesterol. Here is an insight that surprises many people. Visceral fat is strongly influenced by lifestyle patterns, rather than just calorie intake. That means someone who is stressed, sleep-deprived, and sedentary may accumulate more visceral fat than someone who simply eats a bit more, but stays active and well-rested. Recognizing these early signs is not about creating fear. It is about giving yourself a gentle nudge to pay attention before more serious problems develop. Many people believe they are doing the right things to lose fat, but some everyday habits can actually push visceral fat higher without them realizing it. This is where things get a little tricky, because the problem is often not a lack of effort, but effort in the wrong direction. One of the most common mistakes is extreme dieting. Studies have shown that very low-calorie diets can slow down metabolism and increase cortisol levels, a stress hormone that promotes fat storage around the abdomen. When the body feels threatened, it holds onto fat more tightly, especially visceral fat. So eating less is not always the smarter solution. Another hidden factor is chronic stress. Research from institutions like Harvard has highlighted how prolonged stress leads to consistently elevated cortisol, which directly signals the body to store fat deep in the abdominal area. This means that even if your diet looks clean, ongoing stress can still block fat loss. Sleep deprivation is another powerful but often ignored trigger. According to studies published in sleep medicine journals, people who sleep less than 6 hours per night tend to have significantly higher visceral fat levels. Lack of sleep disrupts hormones like leptin and ghrelin, increasing hunger and cravings for high-sugar foods. Here is the aha moment. Visceral fat is not just about what you eat. It is about how your body feels and functions daily. A stressed, exhausted body will store fat even with a decent diet. Once you understand these mistakes, you can start shifting from fighting your body to working with it. If there is one thing I want you to take away, it is this. Your body is not your enemy. The goal is not to punish it into losing fat, but to support it so it naturally lets go of excess visceral fat. This shift in mindset alone can change everything. If you find this perspective helpful, consider subscribing to the channel so you can continue learning simple and sustainable ways to care for your health. Science consistently shows that sustainable fat loss comes from consistency, not intensity. According to guidelines from major health organizations, even a modest weight loss of 5 to 10% can significantly reduce visceral fat and improve insulin sensitivity, blood pressure, and cholesterol levels. That means you do not need extreme transformations to see real health benefits. The first principle is stability. Eat regularly. Avoid long periods of starvation followed by overeating, and aim to keep your blood sugar steady. The second is balance. Instead of cutting out entire food groups, focus on combining protein, healthy fats, and fiber to support metabolism. The third is gentleness. Gradual changes are more effective because they reduce stress on the body, which in turn lowers cortisol and supports fat loss. Here is a powerful insight. Your body responds better to safety than to pressure. When it feels nourished, rested, and balanced, it becomes much more willing to release stored fat, especially visceral fat. This is not about quick results. It is about building a body that feels safe enough to heal. When it comes to reducing visceral fat, what you eat matters, but how you combine your foods matters even more. The goal is not restriction. It is creating a metabolic environment where your body feels stable and supported. Research published in journals like The Lancet and Harvard Health has shown that diets rich in whole foods, especially fiber and healthy fats, are strongly associated with lower visceral fat levels. One of the most effective approaches is increasing soluble fiber found in foods like oats, beans, apples, and vegetables. Studies suggest that every additional 10 grams of soluble fiber per day can reduce visceral fat accumulation over time. Protein also plays a key role. Adequate protein intake helps preserve muscle mass and improve satiety, which naturally reduces overeating. This is important because muscle tissue helps regulate blood sugar and increases resting metabolism. Including simple sources like eggs, fish, tofu, or lean meat in each meal can make a noticeable difference. Another important factor is reducing refined carbohydrates and added sugars. These foods spike blood glucose and insulin, encouraging fat storage, especially in the abdominal area. This does not mean eliminating carbs completely, but choosing slower digesting options like whole grains instead of processed ones. Here is a gentle but powerful insight. Your body is not confused. It responds clearly to signals. When you give it stable blood sugar, enough nutrients, and less processed food, it naturally shifts away from storing visceral fat. Think of your meals as a way to communicate safety and balance to your body, not as a source of stress or restriction. Many people think they need intense workouts to lose dangerous fat. But when it comes to visceral fat, consistency matters far more than intensity. In fact, pushing yourself too hard, especially when you are already stressed or sleep deprived, can actually slow progress. Research from organizations like the American Heart Association shows that moderate physical activity, such as brisk walking for 150 minutes per week, can significantly reduce visceral fat and improve metabolic health. This means something as simple as a 30-minute walk most days of the week can already create meaningful change. Strength training is another powerful tool, but it does not need to be complicated. Studies have found that building muscle helps improve insulin sensitivity and increases resting energy expenditure, which supports long-term fat loss. Even 2 to 3 short sessions per week using bodyweight exercises can make a difference. Here is an insight many people find surprising. Your body burns fat more efficiently when it does not feel threatened. Gentle, regular movement sends a signal of safety, while extreme workouts combined with fatigue can increase cortisol and encourage fat storage. The key is to choose forms of movement that feel sustainable and even enjoyable. Walking, light resistance training, stretching, or even dancing in your room all count. When movement becomes something you look forward to instead of something you fear, your body starts to cooperate in ways that feel almost effortless. You can eat well and exercise regularly, but if your sleep and stress are not under control, visceral fat can still hold on stubbornly. This is one of the most overlooked pieces of the puzzle, yet it has a powerful impact on your metabolism. Research published in journals like Sleep has shown that people who sleep less than 6 hours per night tend to accumulate significantly more visceral fat over time. Poor sleep disrupts key hormones such as leptin and ghrelin, increasing hunger and cravings, especially for high sugar and high fat foods. It also reduces insulin sensitivity, making it easier for the body to store fat rather than burn it. Stress works in a similar way. Chronic stress leads to prolonged elevation of cortisol, a hormone that directly promotes fat storage in the abdominal area. Studies from institutions like Yale have found a strong association between high cortisol levels and increased visceral fat, even in individuals who are not overweight. Here is a gentle but important insight. Your body does not separate emotional stress from physical stress. Lack of rest, mental pressure, and overworking all send the same signal, that it needs to conserve energy and store fat for protection. Improving sleep quality and managing stress does not have to be complicated. Simple habits like going to bed at a consistent time, reducing screen exposure at night, or taking a few minutes each day to slow down your breathing can gradually shift your body into a more balanced state. Sometimes the most powerful changes are also the quietest ones. Starting can feel overwhelming, so instead of trying to change everything at once, let's gently walk through a simple 4-week approach that your body can actually follow and sustain. Before we begin, if you want more practical and realistic health guidance like this, make sure to subscribe to the channel so you do not miss future videos. In week 1, focus only on awareness. Pay attention to your meals, your sleep, and how often you move during the day. No pressure to be perfect. Just observe. Research shows that self-monitoring alone can significantly improve health behaviors because it increases mindfulness. In week 2, begin stabilizing your meals. Add protein and fiber to each meal and reduce sugary snacks. This helps balance blood sugar and reduces the signals that drive visceral fat storage. In week 3, introduce gentle movement. Aim for at least 20 to 30 minutes of walking most days. If possible, add 2 short strength sessions. This is where your metabolism begins to shift more noticeably. In week 4, focus on recovery. Improve your sleep routine and create small moments of relaxation during the day. This step is often the missing link that allows fat loss to finally happen. Here is the key insight. Real change does not come from doing everything perfectly. It comes from doing simple things consistently. By the end of 4 weeks, you may not just see changes in your body, but also feel lighter, calmer, and more in control. And that is where true health begins.